All righty, gang. It's 10:03. I think we're going to get started. It is good to see everybody here. Welcome to the Healthy Work Campaign's panel discussion on burnout. My name is Mark Van Landuyt. It is wonderful to see such a distinguished audience with us. I said this a little bit earlier. We're going to have a discussion amongst the panel that we have here, and then we're going to open up the floor to the audience for Q&A to expand the conversation. And the conversation we're going to have is about burnout. And when you say burnout to a worker, they immediately know what you're talking about. There is that glimmer in the eye, the look of recognition of what you mean. And it's no wonder. We are seeing surveys that have numbers like 77% of the respondents saying that they have experienced burnout in their workplace, with more than half of them saying they've experienced it more than once. There was recent research released by Microsoft. They did research on 20,000 people. They had findings where 50% of employees were saying that they are currently feeling burned out. And those numbers also include 53% of managers saying that they feel burned out right now at work. So this is a real crisis, and people are suffering. And one of the things I learned in the social sciences and medical sciences and in politics is that everything is connected to everything else, just as we humans are connected to every other human being. Just as our species is connected to every other species on the planet. And when we talk about burnout, we're talking about a whole lot of other things as well. And I can think of nobody better to have this larger discussion than the incredible people we have on today's panel. Going from my Zoom left, we have Dr. Peter Schnall. Peter is founder of the Center of Social Epidemiology. Peter is a pioneer in his field. He's put forward important research about the effects of work stressors on physical health. Peter is a wise and dynamic force for good in this world. That can also be said of the next panelist, Dr. Marnie Dobson, who Dr. Dobson, as well as being a professor at the University of California, Irvine, Marnie is co-director of the Healthy Work Campaign, where I have the honor of working with her. Both Marnie and Peter have committed to turning their years of research into now actively changing the American workplace to the benefit and health of the workers. Next to her, Dr. Pouran Faghri. Dr. Pouran is professor at UCLA's Department of Environmental Health Sciences, previously professor at the University of Connecticut. She is a directing member of the NIOSH Education and Research Center of Southern California. Dr. Pouran is an innovator. She's an innovator and a visionary in creating intervention models for workplace stress and injury. Like I said, Dr. Pouran is cutting edge. And so we're happy to have her with us. And next to her, Dr. Viviola Gomez-Ortiz. She is professor of psychology at the University of Bogota, Colombia. She teaches on the psychology of emotions, stress management, and occupational health. Burnout has been a particular phenomenon that she has concentrated her attention on. Dr. Viviola is much in demand internationally. And so we're very pleased that we could get her today. Also, we're very pleased to have with us a special guest, Dr. Julie Mendez-de. Julie is education director at AFGE, the American Federation of Government Employees. She's an organizer who is always organizing. She's an educator who is always educating. And AFGE has been uniquely aware of the conditions that create burnout, and AFG is uniquely focused on protecting their workers, their members, and her perspective from labor is invaluable. So that's the panel. These people are the best of the best, and it's great to have them here. like I said, we're going to go to Q&A after we have a discussion amongst the panelists. And the first question I have, which I'm going to direct to Dr. Marnie Dobson. As I said earlier, everybody thinks they know what burnout is. I think it was Samuel Johnson who said, the word that everyone thinks they know the definition of is the word that most needs to be defined. So I asked her, what is the medical definition of burnout? And how is burnout different from exhaustion? Dr. Marnie.
Great. Thank you so much, Mark. And Mark is our wonderful outreach director for the Healthy Work campaign, and is doing a fantastic job reaching out to our fellow community members and occupational health researchers and labor folks to, get the ball rolling for our Healthy Work campaign. So I'm very pleased that Mark can be here to moderate, because he has the most fantastic voice, and we appreciate that in his personality. But yes, to burnout, I think you're right, Mark, that everyone, in the culture in general, we sort of, people know what they think they know what burnout is, and they know it when they experience it, and it is a common part of the common parlance, burnout. I know people who have experienced burnout personally. Burnout became a topic based on the experience of researchers working with workers. And the idea itself arose from understanding working people and their experiences. So some of the early work on burnout was prompted by this experience from working people themselves, these feelings. It has three major components, which you'll hear a lot about. The first major component, and before I say that, burnout has been measured in many different ways by researchers. There are different kinds of derivations on the theme of actually measuring it for research purposes. So we have the common understanding of burnout. We have the way it's measured for research on burnout. And I'll say a little bit about the quote medical definition in a moment. But the three major components, as we understand them, are emotional exhaustion, or some kind of essential level of exhaustion, sort of beyond fatigue. It is, commonly measured by asking people questions like, do they feel used up at the end of the day? The other component is depersonalization or cynicism. So in order to be burnt out, you also have to have a sense of sort of a disconnection from clients or customers or patients, maybe even students if you're a teacher, a sense of losing faith in the system that you work for, feeling cynical about the system, cynical about the people that you're serving and or working with. And then lastly, the last component is professional efficacy or professional accomplishment, which is often measured in a protective way. So if you have high levels of professional accomplishment, you feel good about your job, you feel like you are doing your job well, and that's the experience of professional accomplishment. So when you're burned out, you have really low levels of that. You're feeling like you're not doing a good job, that you are struggling to perform adequately. So those three components are considered the major parts of burnout. Now, burnout itself is actually not a medical condition. So in 2019, the World Health Organization defined burnout for the first time as part of the International Classification of Diseases. And it isn't actually classified as a disease. It's considered an occupational phenomenon that is related to exposure to chronic workplace stress. So it separates burnout into something that is very work-related. And because there is so much evidence that it is work-related, that there are these factors in the workplace that contribute to occupational burnout that are very common and well evidenced. And we can talk more about what causes burnout as well.
Great.
Yeah.
Great. Interesting. Dr. Pouran, what are the working conditions that create burnout? And has COVID exacerbated these conditions?
Yes, good morning, everybody. Good afternoon. Thank you, Mark. Well, as Dr. Dobson said, when we are thinking about burnout, and in the scientific literature, you always find, and we said, burnout is the state of mental, physical, and emotional exhaustion that's sustained for long work-related stressor that stay for a long period of time. So obviously, in our lives, we need some level of stress. However, we need time for recovery. And it's good for your health, it's good for your performance, it's good for your advancement. Burnout happen when you have a continuous and chronic work-related stress, and as Dr. Dobson said, end up to now causing some symptoms. So some of the causes, if you look at the literature, if you look at the reports, are unfair treatment at the workplace, lack of role clarity. Many times employees really do not know what they're supposed to do, and they keep on working and working without being acknowledged at the end of the day that what they put into the work is actually something that they were supposed to do. One of the another major issue that comes up is communication. Even in my own research, when we are talking with individuals who are at the high stress workplaces, the first thing that come to their mind related to the burnout is lack of communication between management and leadership with the employees about expectation, about resources. You need to talk to employees about what their needs are, and unfortunately, that is lacking, and that causes lack of resource. So sometimes we have these models that we develop and say high demand, low control, or low reward, or low resources. All of these models would end up to burnout. Also, there is a major misconception or misunderstanding about burnout, that employers think burnout is about an individual rather than this being an institutional problem.
Mm.
Burnout, it's not an individual problem. It's not something that you can tell an employee to go and take a yoga class or take a day off or do a breathing techniques. It's a band. These things are like a band-aid you're putting in a major problem. So it is time, I believe, for organization and the leaders to start thinking about burnout in their employee is an organizational issue, and they have to start looking at the data and find out what's going on. It's actually very interesting. Somebody brought this parallel and said it's like when you're sending these happy, cheerful canaries to a coal mine. When they're going in, they're all happy, they're singing, and when they're coming out, they're sick or dead. It's the same situation. Canaries do not get disease by themselves. The environment get them disease. And so we need to look at the burnout the same way that actually the toxic environment in the workplace need attention in order for us to attend to the burnout. So going back to your question regarding the COVID, obviously we had burnout before COVID. As you said, some of the data that you presented were from Gallup poll of 2018, which actually showed that individuals are reporting to have burnout. However, as you know, pandemic basically changed the way we worked and where we worked. We end up being locked down at our homes. We end up taking care of the children, taking care of the elderly. Many parents lose their caregivers at the home because nannies or babysitter would not come to their homes anymore. So not only they have to take care of their family members, they also have to attend to their work with this worrying about losing their job, because job security was a huge issue at the time. So obviously, managing, me and Dr. Dobson wrote a report regarding this about breaking the boundaries between work life and family life, because children where parents now suddenly have to teach their children what they have to perform at their work. There were also other group of workers, including healthcare workers and service workers, that know not necessarily they have to work from home. They have to get out of their house because that's part of their job. And so they're thinking about exposing themselves and their family members to the COVID, at the same time worrying about doing their job, especially healthcare worker, which I'm sure Dr. Schnall is going to talk about. We had a huge issues regarding burnout in physicians and nurses. And if you remember some of those captures from the TV, that many of the physicians were sleeping on the floors, many of them really, because many were getting sick, they're not coming to work, so they have to take care of the work of the others. And at the same time, they were overworked, and then they have this worry behind their mind that they're going to take the COVID to their home. I had a friend who was a physician, and he said he was coming home. In the garage, they established a shower. So he was basically taking off everything in the shower, and he's from Connecticut in the cold, and was not going inside because he was worried about exposing the family members. So obviously, coronavirus traumatized our daily life and contributed significantly to the burnout that we had before.
Thank you for that. And that leads nicely into my question to Dr. Viviola Gomez-Ortiz. Dr. Pouran was talking about frontline workers. My question to you, is burnout a phenomenon merely of the professional class? These are the people that talk about burnout most. Does burnout look different depending on what the job is or what the industry is?
Okay, thank you, Mark, and good afternoon to everyone. First of all, I have to begin to say that I do not agree with Dr. Marnie Dobson. Marnie, I do not agree that when you said burnout, everyone knows what we are talking about. I think everyone thinks something different. And I have a concern about that because I think we are beginning to make the concept of burnout useless. Because when I talk with many people and I read many news about doctors having burnout, nurses having burnout increasing, I not always understand that they are talking about what the original researchers define burnout. I think a lot of people is talking about burnout as if burnout was just exhaustion, being fatigue or an extreme case of fatigue. And I think this problem is not only between lay people. I think we have this problem between even researchers. We all do not always talk about burnout in the same way. So that makes it difficult to answer your question, Mark, because some people measure burnout measuring one thing, and some people measure burnout in other people talking about or measuring something different. So there is one thing that is important to say is when the concept was proposed by Christina Maslach and other people before her, but she was the one that made the concept more clearly defined and developed one of the first instruments to evaluate burnout. She noticed this phenomenon, she says, between people working with others in the service area, in the service occupations, nurses, professors, teachers. And the first version of the questionnaire was a questionnaire that was devoted to evaluate these three components that Marnie described in these people. But with the time, other researchers began to notice that the same components were also noticed in other people. In fact, they didn't have this component of detachment from the people, this cynicism component, but there was a detachment from the work itself. Like, I don't care, it doesn't matter to me. So Christina and other researchers that also have defined and create other instruments create versions to evaluate burnout on other occupations, on other professionals or other. I was having this morning a discussion with Peter about what in English is considered a professional, because you asked me if that is from professionals. And I understand that in some ways professional is implying that you have to serve others. But my answer to your question is you don't have to be serving others, but what the research is showing more is you have to interact with others. Is the interaction with people, either by serving them or by having to work with them. And that includes your bosses, your colleagues. The relationships with other people seems to be a key matter in one of the main sources of burnout. Again, whatever burnout may be defined, because I'm talking here about two different problems. One is, yes, burnout can be found in different kind of occupations, service or not service, but they all imply interaction with people, with other people. But again, my problem is we cannot know how much there is problem. We cannot compare occupations because your research is full of studies made with different definitions, with different instruments that do not exactly measure exactly the same thing, do not have cut points in the same way. The only instrument I know that do this in a better way is an instrument that was developed first in Spanish by Pedro Gil Monte in Spain. And he created an instrument that has cut points that are defined, that are equal in every time you use the instrument, which is not the same with the Maslach burnout inventory, in which people can define their cut points differently. They can put just the three components together and say people is high on this and this and this, but there is not a single clear way of summing up these three components and deciding who has burnout and who has not. In the case of the questionnaire of Pedro, which has been begun to known as the Spanish burnout inventory, he has a third or fourth component, Marnie, that adds to what your definition is. He talks about guilt. He says people that not only has the three components, but in addition to that feel guilty for feeling the way they are feeling, those people are the people that are most at risk of developing health problems. So that questionnaire allows to compare occupations, to compare people because of the conditions I have just described, that they have a different way of measuring burnout. But if you ask me, can we set who has more burnout in the world in comparing occupations, I can tell you that it's not possible right at the moment because we don't know that everyone is measuring exactly the same. It has been most study on people that are in the service area, but that doesn't mean that they are the ones that have more burnout.
Very interesting. Just in the interest of gallantry, it wasn't Marnie who said everyone knows what the definition of burnout is. I am the guilty party who said that. But you were saying about people that have to deal with people, the people that have to deal with the public, and that's certainly
deal with people means you interact with your bosses, you interact with your colleagues.
Mm-hmm.
Yes, that doesn't mean serving them, it's working with them.
Right.
Yes. For example, I can mention briefly, I just finished last year a dissertation direction of a student of mine. She was looking at the phenomenon in a different way. She was studying something that is called task interdependency. How much you have to coordinate or your work with other people to get to a goal, you know? So what kind of people do you have to interact with, and how much does those people interact between themselves? And looking at who is more at risk of developing burnout, depending on how much people do you have to interact and what kind of interactions are those, and if the people you interact with interact between themselves. And what Maria Camila, my student, find was that the people that were more at risk is people that has to coordinate a lot of people that are not connected between them, that they don't have interaction between, but you are like kind of node that have to connect a lot of people, so they all have to work for a goal to get to some result. Those people are more at risk of burnout. And we are not talking here about service. We are talking is about coordinating work of other people. So this is an example of kind of interacting with people that has nothing to do with service.
Thank you for that.
If I just make
Sure.
a comment, sorry about that. I absolutely agree with you, Viviola, that when employees are given an opportunity to discuss their works and make a decision about their works, that's where we have less burnout. And you're right. And if an employee give the control over their job as to how to do it, then they could be educated and there would be communication about who to get to, how to work with other people, and obviously to get the common goal. One of the unfortunate thing about burnout and one of the unfortunate issues that we have in our workplaces is the top management, they think that they know and they basically dictate the work to the workers. And here is somebody sitting in their office trying to find out how to do the job by themselves. And that's where I actually talk about we need to educate our leaders. We need to educate our supervisors or management to find out what motivates the workers and what frustrates them. And in order to do that, they have to have more, what can we call it, engagement, we can call it participation. But when they start to hear their employees, I believe that they will have better performance and more productivity and less healthcare costs, which is associated, as you know, with the burnout of work stress. So my feeling is that we continuously going back to the individual workers without looking at the systematic issue that existed. We need to attack the system and we need to educate the system. That's my...
No, I agree with you.
I want to bring in Julie just real quick. Speaking of control over their jobs, Julie, as education director for AFGE, which the workers who certainly have to deal with a lot of interactions, I'm wondering, how does labor approach the identification and resolution of worker burnout?
Well, again, I think a lot of it does go back to the language and how we define burnout. But I do think that traditionally, the labor movement itself is based on collective action. And so when workers get together to identify what the issues and problems are, and basically having to force the hand of management or the leaders of the organization, demanding them to take their needs into accountability. And historically, that's wages, you know, the weekend, the 8-hour day, those types of things matter. And as it's evolved to other things, you know, benefits, work-life balance, and things of that nature. I do think, though, that culturally, there are some bad habits that have bled over into, you know, even the labor movement. There is a saying that says unions are among the worst employers. If you're a staff of a union, I'm serious. It's crazy because as an organizer and as a political activist, I'm sure you know, you're expected to be working your tail off 24/7 in the middle of a political campaign or whatever that is. And so in recent years, you've seen some demands around campaign workers to reach some kind of agreement around these issues. I heard so much. I do think still one of the things I was curious about is demographically and globally. I think our culture of hyper productivity and our cultural way of thinking, if you're not doing anything, that you're lazy, that you are slacking off, I think a lot of these perceptions are, work against us. And quite frankly, many employers and managers do not take it seriously. It's still very much regarded as woo-woo, positive psychology stuff. It's now being taken much more seriously because of the pandemic. But even, when I have, in my situation, when I look at what I do on a daily basis, I simply try to be accountable for my individual responses and my interactions with the people that I work with. And we have had some success in getting mental health awareness training happening, starting the conversation, because I think these conversations and change is ultimately, many conversations with our employers, with our coworkers, to really figure out what is needed, what the problem is, and that people need to start to create their own solutions that are accessible to them within their sphere of influence to address their needs. So, and then once they have solutions, they can take their ideas to management and ask for what it is that they need.
Right. Great. Thank you for that. Thank you. Peter, I'd love to hear your thoughts on everything that you've heard so far, but I also, the professions that have the most identified amounts of burnout looks like to be teachers, human and customer services, the tech industry, and most alarming in healthcare. Not just nurses, but physicians are facing unprecedented rates of burnout. Peter, what is going on here?
Can I have as much time as the first 6 speakers?
Of course you can. Of course you can. You will take it anyway.
First of all, let me say I've really enjoyed the presentations from my colleagues. A lot of very interesting issues have already been put on the table, and I think that's really very helpful. I want to just raise a couple of issues that I haven't heard mentioned, and that is, there have been historical processes going on around work that preceded the onset of the COVID epidemic.
Yep.
That has made workers more vulnerable to the COVID epidemic, that need to be recognized. So as a physician who has practiced and suffered burnout myself personally, the 3-legged stool version of it, exhaustion and cynicism, and loss of sense of personal efficacy as a chief resident at Lincoln Hospital in 1973, so I have a very clear idea of what were the conditions that I was working under that led to that personally. I think when we're thinking about the current epidemic, we have to understand that a number of the professions have undergone incredible historical changes over the last 20 years, and that primary care physicians are not doing the same practice of medicine that we did 20 years ago. 20 years ago, people had patients, they knew them well, and they took care of them in their office practices. And when they needed to go to the hospital, they were sent to the hospital, and the doctor followed them in the hospital and took care of them in the hospital. They were their patients from their practices to the hospital and back. But over the last 15, 20 years, there has been a dichotomization of the practice of medicine, so that technology and hospitals have taken over the responsibility for caring for people from primary practice. And that has meant that doctors oftentimes send people off to the hospital only to learn from the hospital about horrible things that are happening to them, which creates a situation of moral distress among health practitioners. First, obviously among people who are practicing in their offices, but then among those practicing in the hospitals, because they do not, the doctors and the nurses in the hospitals do not have close interpersonal relationships with the patients who are coming to them. And so they work extraordinarily hard to try and save people's lives. And then those people up and die on them in the hospital. And now you have another moral distress, another fundamental failure of the system in which the practitioners, okay, are faced with this outcome, which is knowingly preventable in many cases, okay? So you have practitioners in their office losing track of people in the hospital, and you have hospital workers taking care of people without adequate resources to do a decent job. And both groups of people, I think, are experiencing an incredible level of distress. And that has to be understood to be coupled with, okay, a profound increase in demands and workload that preceded COVID, okay? It preceded COVID because doctors, well, I practiced medicine for 7 years, and I left practicing medicine when they kept saying to me, oh, this next month you're going to see 30% more patients than you saw the last month. And the handwriting was on the wall decades ago, before I entered my professional life as an occupational health epidemiologist. The healthcare system is designed, yes, to provide care, but it's mostly and predominantly designed, in my opinion, to make money. Okay, so we can't talk about burnout and exhaustion except in the social context of exploitation of people, of human beings, both the people who serve and the people who are receiving the services. The practice of medicine has changed dramatically, okay? There's far less social relationships between people, between doctors or nurses and their patients under the kind of crisis circumstances that we're seeing in our modern hospitals. COVID has led to increased social isolation of practitioners. We've seen a decline in social support between hospitals and the practitioners. And we've seen a breakdown in the relationship, in my opinion, between the office practice on the part of physicians and their patients, which has been exacerbated in some respects by telemedicine, because it's no longer safe to come to the doctor's office, particularly for older people. The doctor doesn't want to see you in your office if he doesn't know what's the matter with you, okay? So he wants you to call, and you'll have a totally different set of social relationships going on at home and with the doctor. Now, under these circumstances, what do we know about the practice of medicine? Physicians are sitting in their office, seeing a stream of patients, and they are being asked to collect information so that the medical system can be reimbursed. And 5 or 10 years ago, this information was collected through voice dictation. Okay, doctor would see a patient, then he would quickly dictate all his notes. And now the doctor that's not good enough, because there were too many errors in the voice dictation system. And they require the physician to sit at the desk and type in everything that's being said by the patient. Now, any of you who have gone to see a doctor in the last 2 or 3 years or 4 years or 5 years know that when you go to see the doctor, he is sitting with his back to you, with his hands on a typewriter, okay? And he is typing in his notes, looking over his shoulder at you and asking you questions. And so eye-to-eye contact and intimacy between the physician and the patient has declined dramatically, okay, at least for doctors. It it's very uncomfortable to be a patient, okay, when your doctor is sitting with his back to you. And so this has led to a further deterioration of the relationship between the doctors and the patients.
So
I think that's the major thing that I can contribute to the discussion. Okay, I think that we have produced a system which alienates and isolates the professional practitioners from their patients and their clients, increasingly so, and exacerbated by COVID. Okay, and it is a failure on the part of the managers of the system to understand that there are human beings on both sides of the relationship who need to be taken into account more completely than we're doing. So I'll stop.
Can I just add something real quick, Mark, to what Peter's
absolutely.
saying? Because I think his example of, burnout among physicians, it is, obviously the tasks and the relationships and the status is different, but the same factors are at play for nurses, overwork, understaffed, too many patients. It's prompted national nurses unions to fight for staff patient ratios so that they're not overloaded and burnt out. So I imagine during the COVID epidemic that, the enforcement of those laws was, problematic at best. Also social workers and other human service workers, other public health workers, even before the pandemic, this process of what they call new public management, where these public sectors and also private hospital healthcare systems are being run like, a financial sector business, like a profit-making venture. So people, positions aren't being hired. They're trying to cut back on labor costs, and folks are being asked to carry more patient loads, case loads, and we're seeing burnout as a result of that, I think, for sure.
Thank you, Marnie. That was great.
Yeah.
Mark, may I add just 2 sentences to this
Absolutely.
discussion? Viviola brought the new concept, or maybe a concept that we may be overlooking, and that's the guilt as part of the burnout. And I think this applies much more in the healthcare workers, because as physicians and nurses, our first responsibility is to do not harm and to do the best that you can do for your patient. And when a physician or a nurse is overworked or overwhelmed by their work, and they feel that they are they're coming short in doing what they need to do, or they can do, or they learn to do for their patients, because they do not have resources, because they do not have time, this actually adds to that idea of burnout, because they go home. I remember during the COVID, there were times that some physicians said, I have to decide which patient to admit and which patient to let go home and die.
Oh.
And these are the worst situations. So I think when we are thinking about the burnout, one thing that we need to understand that this is not some concept that is going to be still. It's a dynamic concept. And depending on the time and situation, we need to change our understanding or even make definition regarding the burnout, and specifically regarding situation that we had in hand during the pandemic.
So at this point, I want to open up the discussion to everybody. There was a video I was going to play today, but something remarkable happened last night. I'll describe the video. It's a fairly young man who's a teacher, and he was talking about the large classes of students he has, over 40 in some classes, the number of classes he has in a day. And he was talking about how much he cared about the students. And he was saying how he could not do his job anymore. He said he was overwhelmed by the workload. He was overwhelmed at home by family members with COVID. He was overwhelmed by the demands and the tensions in the school he was working at. It was creating a deep depression that he couldn't fight off. He said he was burned out, and he started to weep. And he took the video down last night, and he said he was very embarrassed by it. You talked about guilt. He asked people to not share what he put out. And I tell you this to remind us that real people are suffering, that people are in pain, and that people are ashamed to talk about what they're going through. And I ask this everybody: is there a stigma to burnout that we as a culture need to get over? Are we not having these discussions to the extent that they deserve? Just wondering what your thoughts were.
Good question.
I think, just like other mental health issues, in this country particularly, there's a sense that it's your fault. If you have a mental health issue or you have burnout, in some way you're seen as weak. And I think partly it's to do with our cultural ethos, especially in the United States, of survival of the fittest. And people are driving themselves because they are often afraid to lose their jobs. There's job insecurity rampant, so no one would admit that they're struggling to keep up. And of course, it's really difficult as individuals within an organization to talk to other individuals that you may end up competing with for promotions, for a new position. So, I think there are a lot of constraints to working collectively as workers around these issues, unless you are represented and you have a union, and there are more mechanisms for unionized workforces to talk about this. But even as Julie said, there's reluctance, and even among unions, there can be a feeling that mental health and burnout are individual concerns and individual issues. So, and ultimately it's all about work. And so I do think there needs to be a cultural shift. And I see it in places. I do have some hope that, we just had the US Surgeon General issue a report called the Framework for Workplace Mental Health, which talks about making workplaces the engines of well-being, acknowledging that work and workplaces and the way they're organized are impacting on worker mental health. Not only is work a place we spend most of our time, and so it could be a screening place for helping individuals that have mental health, but also the factors at work could be addressed to prevent mental health or burnout from getting worse, and or happening in the first place. So, yeah, that's my input there.
So one of the questions in the chat, and for anyone who wants to ask a question of the panel, go ahead and raise your hand. Philip Bigelow was wanting to know about incivility and its role in burnout. And what do you think if there's an epidemic of incivility and how it may be related to the pandemic? So if anyone wants to take that question.
I
Go
see
ahead,
you
go ahead.
Viviola.
Yes.
I will if no one else wants to. I mean, bullying is
Viviola, you're muted.
I think you're muted.
Oh, yeah.
I'm sorry. No, I was going to say, first of all, I believe, and some studies show that incivility is a very important factor in provoking burnout. But I don't believe that incivility, we don't have an epidemic of incivility. It's just that we are now allowed to talk more about that. I believe that the pandemic made the work conditions for everyone so worse that all the results of the mental health and especially mental health problems were so big and so prevalent that we now are allowed to talk about them, that people are talking more about them if we discover suddenly something that was not known before. Many of us that know about this topic were probably surprised how much it began to be discussed, these topics during the pandemic. And not because they were new, it's just because suddenly it was so worse than before that we were in some ways allowed to talk about this and to recognize the problem. But I don't believe it's worse now. It's just we are talking more about that, and incivility is one of those conditions that I think has been prevalent for many years, but we don't talk about them. This is a way of doing management. Management believe that hard and you have to force people to do their job because people do. If you don't do this, they are not motivated to work. You have to motivate them. This is a style of managing. So it has been there for many years, and not only between bosses, but between co-workers. But we are finally beginning to talk about that. So it's my contribution about or a response to that question, which I think is very important.
Thank you for that. Peter, go ahead.
Our last seminar was on quiet quitting.
Yeah.
Can there be another topic that so obviously has emerged, okay, in the course of the epidemic, okay, for discussion? That's probably, which we dissected this in our last seminar as a phenomenon that's probably been going on for a long time, okay? Didn't just happen yesterday, and it's very similar, I think, in terms of the fact that we're recognizing these things, just as I believe the presence of so many people here thinking to talk about burnout is a reflection of the fact that we're coming to grips with the fact that there's a lot of stuff wrong with modern work in the United States and elsewhere that needs decompacting, okay, and discussion and dealing with, which is, you know, why we've organized the Healthy Work campaign. But we're not the only ones who are, you know, we're just one more little group among thousands of groups who are not happy with what's going on at work and want to do something about it. And we want to work with everyone who wants to do something about it.
We absolutely have to, because as I said, there are actual people, actual workers that are suffering and don't know where to turn and don't know what the solution to what they're going through is. And organizations as well. You know, in terms of this happening before, I remember a few decades ago, it used to be called hitting the wall. You know, oh, that person at work hit the wall, and everyone kind of understood what it meant. I think I also heard burnout in a old 1940s movie, The Tipping Point, with John Garfield. He says, "I'm burnt out like a cigarette." David Legrand has his hand up. David, do you have a question?
Yes, thank you. As a labor practitioner and also a quasi-scientist, I look at what we're doing is very productive. All of us, we're identifying occupational stress, including burnout, as a very negative outcome. We're coming up with ideas of how to resolve it, but we're doing it in a very academic sense. We're not looking at one particular issue that drives most employers, not necessarily public employers. Public employers are somewhat of in a different bag, so to speak. We're not looking at the cost issues very well. When we do our research, I think it's really important that we add a cost-benefit analysis to our research. What is it costing the employer to see its workers experience high degree of occupational stress and possibly burnout related to poor work organization? Now, there's other factors in the workplace as well, other health and safety factors. The public sector presents a much different issue insofar as we're not looking at profits in the public sector, we're looking at services. I'd like panelists to comment on that.
I open it up.
I think, David, you're right on. And, you know, one of the things is that there is actually a lot of evidence and data that has shown the effects of occupational stress on any number of outcomes, economic related outcomes for the private sector in particular, but also for that impacts the public sector. We know that high rates of occupational stressors, including things like job strain, which is high demands and low control, issues around bullying, for example, have been shown to cost workplaces, into the billions of dollars when you add together the health effects of those elements, which can increase healthcare premiums. Also, it affects sickness, absence, and disability costs. So we've written a chapter recently that outlines some of this research in this area, but workers and employees who are exposed to these kinds of job stressors and result in burnout or mental health issues end up having more days spent missing work. There's more absenteeism. Also, when workers are at work and they're not, their mental or physical health has been suffering, it costs employers in terms of productivity because people may not be performing at their best. And of course, another big cost for employers is retention and turnover. I think what we're seeing now with the Great Resignation, with the tight labor market, people have gone through such an ordeal through COVID, but even before COVID, a lot of organizations have been experiencing, employees have been experiencing very high rates of burnout and occupational stress. And these are some of the main reasons people give for leaving their jobs, because they're not respected, or they're being treated unfairly, or they're just massively overworked. They feel like a change is the only thing that will help them. So, I think you're right, David, that employers need to know that not addressing these things and seeing them just as a woo-woo positive psychology issue, and that people should hit the wall and climb over, which is a famous sort of quote from one of the CEOs, I think it was of, it might have been Amazon, that it's actually costing them their bottom line in the end. And you can balance that out, but losing people costs money to rehire, paying disability costs, paying for sick leave coverage, and so on. And even just the productivity of the services that are offered and the products that are made can be affected. So definitely there's a case to be made for why organizations should look to the organizational issues in order to prevent these kinds of outcomes in their working people, in their workforces.
I wonder if there's free organizational tools that are out there that can help make assessments of their workplace. Anyway, Ellen has her hand up. Ellen, go ahead and unmute.
Hi, thanks, Mark. Hi, everybody. I just wanted to add one little point. Oh, we always had just one of a. Okay. Last week, I had the great opportunity to participate in the World Health Summit in Berlin. And it was lots and lots and lots of high-level policymakers and parliamentarians and so on and so on. Luckily, I was happy to see a lot of young people and students, but I attended a really interesting session called The Role of Parliamentarians in Global Health. And a woman parliamentarian, I forget what country she was from, but it really doesn't matter because it stuck with me. She said, we as policymakers, we want to use evidence and what is a research-based recommendation and approach in health problems. But we work on very different time frames than researchers and scientists who might take 10 years to produce what they call, we might consider valid and, findings that we'll publish or promote or blah, blah, blah. But the policymaker appeal was, please, researchers, scientists, help us, work with us. We know you want the excellence that you strive for, but for us to help push policies through to help people, which we want to do, good enough excellence is good enough.
Mm.
Yeah.
I think that goes a long way to answer you, Alan, because I think your insight is excellent, that there has been probably 20, 30 years of research on the impacts of work stress on burnout, on work, its impacts on burnout, and its contributions to burnout and other mental health issues. We have a lot of evidence. I put a systematic meta-analysis on burnout into the chat box for anyone that wants to look at it. And there's 25 longitudinal studies that have moderately strong evidence for the impact of work on burnout. And I think, as Alan's saying about policymakers, we do always want more research, but when is there enough research to make that step towards public policy that's going to deal with what is a very problematic area for workers, burnout. So, the Healthy Work Campaign is particularly interested in pushing forward to try to make policy changes, as well as offering tools and resources to organizations that do see this as a major problem and want to find out ways to deal with the problem in effective ways. So there is also some intervention research that that shows organizational changes can reduce burnout. And we have a lot of those on our website. Paul Landsbergis has done a great job compiling research into really short, accessible case summaries of how different groups have made changes to laws or regulations, and also through research partnerships with labor and management to improve work organization, work stressors, and reduce, and actually measuring effective change in burnout. So there is evidence, and I do think that we need to take the next step and push for actual changes along with labor and along with business. I think through partnership with workers, business, and labor, we can make a big difference.
Melissa Q asked the very adroit question: how do you advise organizations that have an overwork culture, a culture of overwork, who want to reduce their employees' burnout? She adds, I find these types of organizations tend to think it's an employee problem, but I agree with the panelists that it's an organizational problem. How can we get them to understand this? And I'll throw in to everyone on the panel the simple question that doesn't have a simple answer: how can burnout be prevented? Everybody.
Well, I can actually address related issue on the leadership and as it relates to the burnout. And I absolutely agree with the person who had the question, because studies have shown that high pressure firms have 50% higher healthcare costs compared to the other organizations. And there is an estimation related to the workplace cost as it's related to the stress, about $500 billion and 550 million workdays lost due to the job stress. So when we are talking about the organization, unfortunately, what we need to talk to them is about what they're losing. And you need to put the dollar sign in front of the organization to make them understand that really burnout is not an employee's issue, it's their issue. So if they care about their employees, it's time for them to address this issue, because work-related healthcare cost is about 8% of our national healthcare. And when you're thinking about this and realizing that, for example, we all talk about employees turnover, 63% of employees who are working in high stress workplaces, they said that they're seeking another job. And studies have shown that it costs an organization about 4 times of employees who leave a job to hire a new one. So the question comes, how we need to change the culture of the organizations? I believe as educator, maybe our first task, rather than, we are very good in producing data. We are very good in producing p-values and correlation. And we read our own papers and we are very happy with what we are producing. And I think it's time for us as researchers, if we are going to address the burnout, it turn those numbers is a more understandable way and educate our leadership in organization. And when I'm talking about leadership, really, I'm not talking about line manager and middle management, because those are the most burnout people, because those are the people who are actually are sandwiched between the leadership of the organization that pushing them to get to where they wanted to be, and they have employees who are frustrated and burned out, and they cannot perform. So you cannot be the dead horse. So I think it's very important, maybe as a researcher, to talk about how we can educate leadership of the organization to listen to us, to realizing that the toxic environment not only costs their employees, but costs their bottom lines as well. And they're losing their best employees if they're not investing on them. And that's the major issues that I think it's important. It's not health promotion and wellness anymore. It's and I think I'm responding to Heather's concern, which she just came in, and I wanted to hear her because she said she's burned out and she thinks we need to have organization to hear us. So I let her talk because she has her hands up.
Hi, good afternoon, everyone. Thanks for having me. I'll make it very brief. So I am going through major burnout myself. I've been with the agency for 8 years. I went from having a team of 6 recruiters to now we're down to 3 because they got fully remote work options with the VA. And as you can imagine, working at the Department of Health, we have a lot of public health initiatives tied to COVID, to monkeypox, to measles, you name it. And to answer the question about how to eliminate burnout, I think one of the things that they're trying to do, but it's still slow, is to strengthen our wellness programs. They're starting to offer yoga classes for us. And now each floor has a treadmill on it with a computer attached. So everybody gets 45 minutes on the treadmill. We take turns. So you can, yeah. So that's one of the ways. But I just think especially when you work in the public sector, it's kind of harder to achieve that when, like I said, we're losing people to full remote options. So the reality is, while they acknowledge that there's burnout, it's kind of challenging when the work still has to get done and there's limited staff available. So I think it's a bigger fix in the long term, but I can relate very well to this session.
Wow.
Yeah.
A treadmill with a computer on it is the perfect metaphor. Perfect metaphor
Yes.
for our work culture.
So you can check your emails while you're standing there, and you can have a max of 45 minutes.
Work.
Yeah, to rotate. So I've been taking advantage of that to de-stress a little bit.
I think Julie had her hand up. Thank you, Heather, for sharing.
You're welcome.
Thank you so much, Heather. Thank you.
You're welcome. You're
It's
welcome.
interesting, I think, the treadmill concept, because in many ways, the antidote for stress and burnout is down regulation, more like yoga, and sometimes exercise stresses me out even more. But I did want to say, I don't think we should underestimate the power of imagination and how we can imagine and reimagine what a workplace that supports workers looks like. Because some of us are so burnt out that we don't even have any leftover to think about that. And even though the leaders and program heads will be implementing some of these programs, it's really critical that you ask the employees what it is that they need, right? Mm-hmm. And think out of the box. Sometimes I've thought, oh, it would be so great to have like a meal service, that I could pick up my meals at the end of the day and take them home. And I don't have to worry about dinner, or whatever the wildest, most ridiculous, absurd idea is, to give voice to it. Because maybe one aspect of that is possible, right? Imagining what's possible is just as important as all the policies and laws and things that we have put in place.
Thank you.
Yeah, I think one of the approach that we proposed in our research was a participatory approach in addressing workplace And we had actually design teams, and these design teams were workers, which was combination of all levels, including the middle management. And they worked together to identify work-related stressors, and they come up with the proposals for the management. And one of the things that you said, you're talking about imagination, and sometimes we said, let's start from low-hanging fruit and move up. And we had very interesting idea, and the fact that employees had a say in something. Obviously, the commitment from the organization and leadership is very important. We need to get that first, because what they propose and nothing happened, it's going to be much more disastrous and disappointing. Yes. So yeah, I agree with that. That sometimes imagination and starting at some place, at least start at some place, is important.
Mark?
Peter, go ahead.
Yeah, I like the trend of this conversation. I imagine a day when workers know what's happening to them systematically and scientifically, okay, because we've been able to get things like national surveys implemented for workplaces to assess the consequences of work stress on the well-being of workers. I was, Julie, I was particularly struck by this when Viviola and I went to Las Vegas and addressed the AFGE membership meeting. We did 2 workshops, and we presented material about work stressors and how they were causing all of these health problems. And the audience reaction was, oh my God, are you telling us that we're not personally responsible for all of our own mental health issues? They were so relieved, okay, to hear 2 professional people standing in front of them, sharing with them the evidence that what was happening to them as workers was not something of their own doing, okay, that they shouldn't be blaming themselves for what was going on. And this is why we've worked so hard for the last 4 years to create the Healthy Work Campaign work survey, which is free, which is automated, which is available online, and any workplace can have its membership fill out the survey and find out what work stressors are present in large numbers in their workplace that are causing so many of these problems. And that information hopefully will get shared among all the workers, and eventually will get shared with management, and maybe the light bulb will go on in some managers' heads, and they'll realize that there's a benefit for them to promote the well-being of their workforce.
So the Healthy Work Survey is a real game changer and potentially revolutionary. And Julie was talking about legislation for workers, getting things in law in terms of work stressors on the public health. And it reminds me of a March for Science chant that we put together. What do we want? Evidence-based policy. When do we want it? After peer review. Dr. Viviola, go ahead.
I do agree with what my colleagues have said about educating managers, educating workers, but I have a huge concern about educating professionals. Heather, when you said that you have now yoga classes and a treadmill, this is because some professionals said to your bosses that this is what you need. I find here so many times that I am consulted by a company, but about what they can do about stress. And when I said about changes in the work conditions, they say, okay, thank you very much. And then I find out that they contact some of my psychology colleagues. And when I find my psychology colleagues, what they are doing, stress management. And so it's easy, they get some money for that, and they advertise that this is a good solution. I have a continuous fight with my colleagues at the university because our university is trying to invite us, the psychology department, to give them advice about what to do with the stress of the people at the university. My colleagues are offering meditation and things like that. That sounds very nice for psychologists. And what I am saying is it's more complicated. So I think that we need to educate psychologists, physicians, professionals to understand this, because sometimes the guilty person or the guilty part of doing the kind of interventions in individuals are the professionals themselves, because they do not understand what is going on, and because they themselves believe that the interventions on the persons is what is needed. So we need to educate not only managers and companies and workers, we need to educate our colleagues about these topics, which a lot of them do not understand really clearly.
Well, in the final moments of this presentation, this panel discussion, I think that's a great way to end. Dr. Peter Schnall, Dr. Marnie Dobson, Dr. Pouran Faghri, Dr. Viviola Gomez-Ortiz, and thank you so much, Julie Mendez-de. Thank you for joining us so much. And we're going to have more panel discussions in the near future. The Surgeon General released the framework for workplace mental health that is important to talk about. We have 7 obstacles to healthy work that we need to explore and really discuss. Please check out the Healthy Work Pledge. Just like the Healthy Work Survey, this is potentially revolutionary. So we're trying to create a coalition of organizations, of like-minded people to force the conversation about work stress and its effects on public health and what organizations can do about it. Then to let workers know that they are not alone, and to let organizations know that there are ways to deal with these issues. And it's so needed. We need to put this conversation to hyper gear all across the nation. Take a look at the Healthy Work Pledge. I'm sure there will be a link in the chat. And once again, thank you all for being here so much. And we hope to see you at the next panel discussion. And thank you, panelists, for making it such a lively one.